Hey guys, today I want to talk about the difference between our segmental bridge in our hip and core program and our standard glute bridge. So you're probably familiar with the glute bridge, laying flat on your back, lifting and driving your butt up into the air, squeezing hard. Great exercise for the glutes and posterior chain. But what's different about the segmental version? Well, what we're working on is the core strength to stabilize each vertebrae at a time. So if we look at core strength, there's those muscles that move and stabilize the spine. And we have some really strong core muscles, okay? Big, strong muscles that can stabilize and hold that canister tight for 500-pound deadlifts and squats. But when we look deep to those big, strong stabilizers, we have these little muscles that connect each vertebrae together, okay? And those muscles are responsible for controlling each segment of that spine. So we call that intrinsic control, okay? The small motions that happen at the spine, we need to be able to stabilize those as well as stabilizing the big, heavy weightlifting movement. So what we typically see when low backs lock up or low backs feel tight is those small muscles that connect each vertebrae are tightened down or spasming. And that's really the source for a lot of low back pain and a lot of issues with low back problems. And so what we're trying to do with that segmental version of the glute bridge is we're trying to create some movement and control of each segment of the spine. So with the segmental version of the glute bridge, you're going to be laying flat on your back. Starting with the pelvis, you'll curl that up. And then you're trying to curl each vertebrae off the floor one at a time. And when you get to the top, squeeze those glutes hard, drive those knees out, and then work on controlling each segment of the spine as you lay it back down. Okay, so developing that intrinsic control is going to be awesome to improving your low back health. And if you feel tight, if you feel like those low back muscles are spasming, if you had a super hard workout, that's typically one of the symptoms. Is you just feel really stiff in your low back. Okay, work on that segmental bridge and get those vertebrae moving a bit, and that usually frees up some motion and relieves some low back pain. And I wouldn't recommend adding this segmental version to your standard hip thrust type movements. And those are weightlifting movements where we want to control and brace that midline, and we don't want to create motion of the spine. But for something like this, it's unloaded, it's great to create that control and movement around those tiny muscles that move and stabilize the low back. So hopefully that helps free up your low back and help solve some pain issues.